Hello dear students. Today we are going to learn about the ectodermal derivatives, neurulation, neural tube defects and neural crest formation. The ectoderm is the outermost germ layer formed during gastrulation, and it differentiates under precise molecular regulation involving BMP, that is bone morphogenic protein, WNT and FGF. These all signals promote surface ectodermal fate, that is, the formation of surface ectoderm, and its derivatives include the epidermis, hair, nails, lens of eyes, enamel, anterior pituitary, that is, the Rathke's pouch. However, the weak BMP signaling leads to the formation of neuroectoderm, and intermediate BMP and WNT signaling leads to neural crest formation. So the other structures formed from the ectoderm are ectodermal plaque codes, like sensory structures like olfactory epithelium, lens, and inner ear components. So we have seen that high BMP helps in the surface ectoderm formation, intermediate BMP and WNT signaling leads to neural crest formation. However, the low BMP helps in the neural tube formation. During the neurulation, the neural plate forms from midline ectoderm and folds dorsally to create the neural tube, which gives rise to the central nervous system, brain, and spinal cord. The anterior neural tube forms primary brain vesicles, that is, prosencephalon, mesencephalon, and rhombencephalon, while the posterior forms the spinal cord. At the lateral edges of the neural neural folds, neural crest cells emerge due to the intermediate BMP and WNT signaling, and it undergoes epithelial to mesenchymal transition and migrate throughout the embryo. It migrates throughout the embryo to form different structures, including sensory and autonomic ganglia, Schwann cells, adrenal medullary cells, melanocytes, and craniofacial cartilages and bones. Now come to the neural tube defects. These are the congenital malformations resulting from the failure of neural tube to close completely during the embryogenesis. It typically occurs between day 22 and day 28 after the fertilization. Closure defects can occur at the cranial or rostral end or caudal ends of the tube, leading to the conditions such as anencephaly, that is failure of rostral neuropore closure, resulting in the absence of forebrain and calvarium, and spina bifida, that occurs due to the failure of caudal neuropore closure. However, the anencephalocele occurs due to the brain tissue protrudes to the skull defect. Depending on the severity, spina bifida, classified as occulta, meningocele, and myelomeningocele. Occulta are completely closed by the skin. Skin completely covers the underlying defect. Meningocele, when skin is absent overlying and the meninges are protrude out of that defect and forming a translucent sac filled with fluid or CSF, and the other is the myelomeningocele, which is the most severe form of the spina bifida, and it includes both meninges and spinal cord protrude out of the defect, often causing the motor and bladder dysfunction. Risk factors for neural tube defects include folate deficiency, positive family history of neural tube defects, maternal diabetes, anti-epileptic drugs like valproate, and genetic mutations affecting the folate metabolism like MTHFR mutations. Diagnosis is suggested by elevated maternal alpha fetoproteins and confirmed by fetal ultrasound. So, prevention is highly effective for the neural tube defect with the help of folic acid supplementation during periconceptional period, and it reduced the NTD risk by up to 70%. All females should take at least 400 microgram daily of folic acid, start 3 months prior to the conception and continued throughout pregnancy. If there is positive family history of neural tube defects, then folic acid should be at higher doses, that is 4,000 microgram daily, and continued throughout pregnancy. Now come to the neural crest derivatives. Neural crest derivatives are cranial derivatives, include the craniofacial cartilages, cranial nerve ganglia, odontoblast, melanocytes, connective tissue of the pharyngeal arches, ciliary and cranial parasympathetic ganglia like pterygopalatine and submandibular ganglia. Cardiac neural crest include the aorticopulmonary septum, that is conotruncal cushions, smooth muscles of the great arteries, parasympathetic neurons of the heart. Truncal neural crest derivatives include the dorsal root ganglia, sympathetic chains, adrenal medulla chromaffin cells, Schwann cells, melanocytes, and vagal and sacral neural crest derivatives include the enteric nervous system, like the Meissner's and Orbeck plexus of the GIT, parasympathetic ganglia of the gut, and endocrine derivatives include the parafollicular C cells of the thyroid and glomus cells of the carotid body. Neural crest defects include the Hirschsprung disease, that is the failure of enteric ganglia formation in the distal colon due to the absent vagal neural crest migration. Second is the DiGeorge syndrome, that is 22q11.2 deletion affecting the third and fourth pharyngeal pouches due to the disrupted neural crest migration causing thymic hypoplasia, hypocalcemia, conotruncal heart defects. Third is Waardenburg syndrome, that is defective melanocyte development leading to the deafness and pigmentary anomalies. And others are neuroblastoma, pheochromocytoma, cleft lip or cleft palate, Treacher Collins, medullary thyroid carcinoma, neurofibromatosis type 1. So that is all for today. Thank you.